Welcome. Thank you for joining our first PCORE monthly webinar. Next slide. PCORE, it stands for Patient-Centered Outcomes Research for Employees of the Near West Side. It's a group of employees, wellness representatives, and researchers who are meeting regularly to share perspectives and explore research as a tool to address health and wellness challenges of employees in the Near West Side. PCORE is currently expanding to support employers within the Near West Side with a focus on health and well-being in the era of COVID-19. Next slide. Today we are going to talk about the flu. And Kelly Wolmer from Marquette University took some time with me a week ago, and we interviewed talking about the flu. So we're going to get that video started, and she is going to share with you why we want to get the flu shot.
Good afternoon, everyone. I'm here with Kelly Wolmer. She is the medical director, or executive director of the medical clinic at Marquette University, and she is here to talk about flu vaccines. We're in a pretty crazy time, not only with COVID, but it is flu season and we're hunkering in and we need to take some precautions. So Kelly is here to share some information with us. Kelly, can you tell us a little bit about yourself?
Sure. I am Kelly Wolmer, and I'm the director of the Marquette University Medical Clinic. I'm a physician assistant, and I've been in practice for 26 years, and I just celebrated my 20th anniversary at Marquette this month. So
congratulations.
Thank you, and thank you for having me.
Well, thank you. So first question is, why is it recommended to get a flu shot?
Well, influenza is a seasonal virus that can cause severe illness, and some individuals can require hospitalization, and unfortunately some individuals even die from the flu. Last year in Wisconsin, for example, there were over 36,000 documented cases, over 4,000 hospitalizations, and close to 200 deaths. So the vaccine is truly our best defense against this virus, and so it's highly recommended that everyone get the flu vaccine.
When can people start getting that vaccine age-wise and time-wise? Is it available?
Sure. All individuals over 6 months of age are eligible to get the flu shot, and it's highly recommended that everyone does. Now is a great time to be getting the flu vaccination. We usually try to target it in the fall, September, October, but certainly we can do it into November and beyond. And the reason you want to get it at this time is flu season usually hits us in the winter months, and so we need a couple weeks to build up that immunity from the vaccine. So fall is the appropriate time.
Okay. And can you touch upon those concerns that, as I mentioned in the beginning, we have this COVID health crisis, flu season's coming along. Can you just help us understand what the concerns are here?
Sure. As everyone likely has been following in the news, COVID cases are on the rise, particularly in our state and in Milwaukee. We're seeing our hospitals nearing capacity in some of our areas. We did see it a few weeks back in the northeastern part of Wisconsin, and now we're starting to see our hospitals also getting full. And as you can imagine, with all of our healthcare workers working and focusing on COVID currently, if we then also have the number of hospitalizations and very sick people from the flu, it's going to be hard to focus on those with COVID. And as you know, we don't have a vaccine for COVID-19 right now. And so if our best defense, again, is to get the flu shot so that we can have our healthcare systems and workers focusing care on those with COVID.
Great, thanks.
Yeah.
And what's our best defense to stay healthy?
Well, I think we're all hearing all of the pleas, and I'll just repeat them. Wash your hands. Soap and water is great. Hand sanitizer that's alcohol-based is great, and you want to do that frequently. We want to make sure that we're not touching our eyes, our nose, and our mouth. With flu, we haven't traditionally required masks, but with COVID, we definitely do, and so that can also help be protective against other viruses. So you should always wear a mask when you're in the presence of others, particularly inside, but outdoors is important too, especially if you're not able to avoid that close contact. So we want to, again, avoid close contact with others and maintain that social distancing. I'm also frequently cleaning your living spaces and your workspaces, wiping down the doorknobs, the handles, computer keyboards, all of those kind of things to help keep virus from transmitting that way. Don't share food and drink with others. And then simply, if you're sick, please stay home. We want to try to, one, you take care of yourself, but also prevent transmission to others. And then the other golden rules, try to stay healthy, get your sleep, be active physically, try to manage your stress and drink plenty of fluids and eat a healthy diet.
Yep. Gotta love those, and which is true now more than ever. Even with our concerns just mentally, to stay healthy is a big challenge for us. So, and the other line I've heard and used to say in a past life is you can't help others if you don't take care of yourself first. So trying to keep our community healthy and well is really what we're trying to get here. And I appreciate your time and effort, and congratulations to Marquette for really making it through this semester. You've done an amazing job. So kudos to your organization and keeping the kids safe and our community healthy as well.
Thank you, Barb.
All right. Have a great day, and we'll wrap it up.
All right. You too. Bye-bye.
Thanks again to Kelly. She's obviously a very busy person, and she's working hard to keep those kids at Marquette safe. So we appreciate that extra time she took with us today. We're here for flu shots. It's really important you get them. Kelly explained why. Wanted to make sure folks knew of some opportunities available here in the near west side and throughout the community and where you can get flu shots. City of Milwaukee is providing flu-free shots, free flu shots. I visited 2 of their health centers. Be sure that you double check on the day of the week and the time. And there are days that it is not open, so keep your eyes out for that. Never a bad thing to check the website or give a call to make sure that everything's running smoothly in those clinics. Next is COVID testing as part of that bigger picture, trying to keep the whole community healthy. If you think you have any symptoms or have had direct contacts with someone at COVID, you can't get free testing at Miller Park. That's happening 5 days a week. And there is a free shuttle available from downtown. You can pre-register to get through that process a little bit quicker, and it is also a walk-up. And I think I found out from a friend the other day, he biked up. So no excuse. Related to flu shots in your private healthcare person or one of our pharmacies, you definitely need to call ahead and make that appointment. We need to make sure people are getting scheduled through in safe distance and staying healthy. So that's one of the big differences that's occurred this year, is taking time to make an appointment before you go get your shot. Next slide. Here's a reminder, everything Kelly said. We just need to do those little things, and it doesn't seem like it's little. We're tired of it, but this even helps fight the flu. And wash your hands, biggie, 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 all those come together. And then very importantly, if you do think you're sick, stay home, check in with doctor, and find out what you need to do next. Next slide. As part of this PCORE process, patient-centered outcomes research for employees of the Near West Side, we are looking to have more employees on our panel. It's really important that we hear that voice and make sure that we can move health forward for all our members to live, work, and play in the Near West Side. If you are an employee that works in a Near West Side partner business, that's who we're looking for, and we want somebody that wants to be a champion and interested in health. Next slide. Since you couldn't read that too well, if you are interested in becoming an employee representative, contact me, Barb Scotty. PCORE@nearwestsidepartners.org is my email. Also to let you know, the 2 primary investigators for this project are Dr. Dan Pinto and Dr. Abiola Keller. So you can touch base with them if you feel like you need some more questions. And keep your eyes out. You'll be seeing a lot more media and promotion of the employee recruitment campaign, because we are looking to expand that part part as well. So thank you again. We appreciate your making it for this very first webinar, and the next one we will be having is on Wednesday, November 25th at noon. Have a great day.